You mentioned like you do routine healthcare, of course, like primary care. What else do you offer within your business?
Sure. Well, you know, with my background, I've always been an athletic type of person and I'm big on wellness. So part of my approach is being very proactive. I'm very into preventative medicine. I really like to push and offer my patients everything that's out there that could benefit them on an individual basis. So in some cases that may be, doing extra cancer screenings or, doing some of these newer things like the Galleri testing or, genetic testing.
Okay.
Or, coronary calcium scores with CTs to, evaluate for, any sort of disease process, even in the absence of active symptoms. But outside of the preventative realm, we do the urgent care type visits. So you don't have to worry about going and calling an urgent care, if you're sick on, a random time frame and you're like, oh my gosh, I need to figure out what to do here. We do our pelvic exams, hormone replacement, and also testosterone for our gentlemen clients. We do joint and trigger point injections. So people don't have to outsource every time, if they have an arthritic knee and they need a shot, I can do that in the office. As long as we have, an x-ray on file, we're good. It simplifies things. They can get things readily without having to wait to get into a specialist for every little thing. Trigger points for non-invasive pain management, wound care. We do IV infusions. So, if we have patients that are, acutely ill with a GI bug or they're on chemo and they're dehydrated, we don't need to send those patients to the ER. Even for something like a migraine. Sometimes we'll have them get an IV, get a shot of Toradol, get a shot of Zofran. These are things that a lot of times people are going to the ER because they have a terrible migraine, but it's something that in primary care, if we have the things available to utilize, we can save them that huge bill from the ER. And honestly, save the ER from having needless visits, especially when this time of year, as we start getting all the increased illnesses, it gets chaotic in there. You could be in there for a few hours waiting to be seen for something simple like a migraine when you could see your primary care doctor. And I could take care of that in the office without trouble, and you don't get a bill because it's already included in your membership.